Hi, I'm Tori Etheridge. I'm a physiotherapist and a certified vestibular therapist. I did my training down at the Emory Conference Center in Atlanta, Georgia through Duke University DPT program. So you're probably wondering, why should you see a vestibular therapist? You want to see a vestibular therapist if you're feeling dizzy or if you're having vertigo. Dizziness and vertigo are actually two different things. Dizziness can be feeling a little bit off, feeling a little bit lightheaded, a little disoriented, versus vertigo is when you're having a sensation of movement. It can be a sensation of movement within yourself, or you feel like the world around you is moving, or just some sort of rocking uneasiness. It can be many different things. So when you're having the vertigo or dizziness, it's good to see a vestibular therapist so that they can assess your vestibular system. The vestibular system is located in our inner ear. We have one on each side. It's a series of 3 different canals and 2 other organs. The canals tell us about rotational movement, meaning if I'm moving my head like this, if I'm moving my head like that, or if I'm turning my head like this. The other 2 organs tell us about linear movement, meaning if I'm accelerating forward or backwards or up and down. And usually if someone's having dizziness or vertigo, we can find something on assessment to tell us what's going on so that we can build a treatment plan. We're going to go to the whiteboard now and I'm going to draw it out for you. We're going to explain the vestibular system a little bit here. So I want you to imagine part of the vestibular system as 3 semicircular canals. So we're just going to say 3 hula hoops. And they're connected together and they're oriented in different planes of movement. Going back to the days of early physics are pitch, yaw, and roll. So our 3 semicircular canals, I'm going to draw 2 of them here, and the third one would be coming out that way, coming out of the board. Inside these canals is fluid. So I'm just going to color it dark where the fluid would be, like that. Okay, and remember the third one's coming out this way. So there's fluid inside these canals, and the fluid moves when we move our head. At the bottom of these canals, there's a little swelling called an ampulla, and inside it there's hair cells. And they're longer on one side and shorter on the other. And there's one at the bottom of each of the semicircular canals. So 3 of these on each side of the ear. 3 semicircular canals, 3 of these. And what happens is when the fluid moves past it, it causes the hair cells to bend one way. When the fluid moves the other way, it causes the hair cells to bend the other way. And that's what sends the information to our brain about how we're moving our head in space. So moving this way, I'm rotating that way. Moving that way, I'm rotating that way. Think of the fluid moving through a hose, okay? This tells us about angular movement. Another part of our vestibular system, which I'm going to detach over here, kind of looks like this. And what this part is it tells us about linear acceleration. It's called the utricle and the saccule. And what it is it's hair cells, kind of like this, at different lengths, and they're in this jello-like substance with calcium carbonate crystals. So imagine jello with a few rocks thrown inside, sitting on top of some hair cells. And they have a bit of weight to them. So when I accelerate horizontally this way, the weight from the jello on top of the hair cells causes them to bend. And my brain says, you're accelerating forward. When I go the other way, the hair cells will bend, and my brain says, you're accelerating backwards. This tells us about linear acceleration. And this one tells us about vertical movement. We're going to talk about a condition called BPPV, and I'm going to show you how I would assess and how I would treat that. But essentially with BPPV, what's happening is some of these crystals are accidentally coming loose, and they're entering into those semicircular canals. Now, if you imagine having a hose with water inside, and if I throw a few rocks in there, is the water going to move as well inside the hose when I go to move it if there's rocks inside? The answer is no. So if I have this happening on one side of my vestibular system but not the other, I go to turn my head, this system is working fine and the fluid is moving and those hair cells are deflecting and my brain says, you're rotating to the left. But on this side, there's rocks in those canals and the fluid is not moving as well, and this side is not reading the information. My brain gets confused and it says, well, this ear says we're turning left, but this ear doesn't. So what happens is I get the sensation like I'm spinning, because there's a mismatch between the 2 ears. We're going to go into a BPPV assessment and treatment as well. So these are vestibular goggles that we would be using for testing. And the really neat thing about them is I'm able to see your eyeball on the computer when I'm using the goggles. So when someone's having vertigo, when they're having that feeling of movement, what we typically see as vestibular therapists, if there's something going on with those canals, is we see something called nystagmus, which means I see your eyes beat a certain way. And if we have something like BPPV, they tend to beat in the direction of the canal that's affected. So we have the goggles on, I can see what's going on with your eyes. Usually when we get you into the maneuver for the specific canal, you're gonna feel that vertigo come on. So you're gonna feel that icky feeling come on. You just need to stay in that position, and we're gonna stay there for twice as long as the symptoms were there. So we're gonna stay there, the symptoms will go away, we're gonna stay there a bit longer, and then we'll go into a treatment, okay? Normally we would have the eyes covered so that you can't see anything because we need something called fixation removed. So if you're able to fixate on something, you're in daylight, you're able to look at something with your eyeballs, you can suppress that nystagmus, which is why we cover the eyes, because if you're in darkness, you can't suppress that nystagmus. And we need to see that in order to tell which canal is affected. So I'm gonna get up now and I'm gonna come to the other side of the bed. I'm gonna be bringing you down onto this side. So I'm gonna place my hands on your head and you can grab onto my arms. Okay, and we're gonna turn your head 30 degrees this way. And on 3, we're gonna lay back really quickly. Okay, 1, 2, 3, there we go. Good. And then we see what's happening with the eyeballs when we're in this position. If there was something going on with one of her canals, say her left posterior canal, we'd be seeing a nystagmus right now. If we were to find something on that testing, we would then put the client through a series of head position maneuvers in order to help reposition those crystals back to where they go. So it's important to see someone who's a certified vestibular therapist because the angles at which we have the head in and the positions where we have the head and how we're doing the assessment, you really need to know your stuff because the crystals could be stuck to that ampulla, they could be free floating in the canal, or they could be in any of those 6 canals. So you want to make sure you're working with someone who knows how to properly assess those canals and which maneuver you need to do based on the findings. Next, we're going to talk about a few other conditions that you can have when you have a vestibular problem. So we use our goggles here, as you saw in the last scene, to assess the vestibular system. We put these goggles on and it allows us to record what's happening in the eye. When someone is having vertigo and it's due to something going on with their peripheral vestibular system, we can see the eyeballs move. It's called nystagmus. So if it's one of the canals that are affected, if it's something like BPPV, we're going to see the eyes beat in a way that tells us about those canals. If someone is having something else with their vestibular system, say a hypofunction, meaning one side of their vestibular system is not functioning as well as the other side of their vestibular system, we'll also be able to see it in the goggles. So this can happen if you've had a common cold, an ear infection, a sinus infection, whatever it may be to cause one side of the vestibular system to be affected. And it could be the vestibular nerve coming from the system into the brain, or it could be more of the peripheral system, wherever the injury might be. For some reason, this side isn't working as well and the information from this side is not being read as well. So we'll be able to see that in the eyes when we do our testing, and then we can tailor our treatment for that. Another type of vestibular condition that we can have, sometimes we don't always see something when we're testing with the goggles. So we don't see an issue with the peripheral vestibular system. And it gets us to start thinking maybe there's more something going on with the central system, meaning how the brain is processing the information from the vestibular system. An example of a condition could be 3PD. Persistent postural perceptual dizziness. And this basically means maybe you had a vestibular episode in the past, maybe you had a hypofunction, or you had something like BPPV, and for some reason the vestibular system is a little bit rattled from the memory of that incident. And you just have this remaining feeling of, unwell, unsteady. You don't like to be in motion, you don't like to be in cars, sometimes if you're sitting still, you feel a little bit worse. Places like Costco or the grocery store where there's a lot of visual stimulus coming at you are very problematic. And that's something else that we work with here a lot as well. If you're having symptoms of dizziness, vertigo, loss of balance, feeling off in busy places, please give us a call or check out our website at www.snpc.tech or Google the Surrey Neuroplasticity Clinic. Thank you.